If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. All right, how's it going?
It's going well. So it's been a busy week, but a good week. Hopefully getting my last new investment in Fund 2 under term sheet. It's been negotiation, but sometimes the best companies, it takes a while to negotiate. So.
Yeah, for sure. It's interesting. As we're recording this, we looked at the top of the Wall Street Journal website, and it's like all greens, except for the VIX, which is great. And feels kind of crazy that in between last week's show and this week's show, there was the escalation of a war, ceasefire, broken ceasefire. President Trump went on television, dropped an F-bomb. Market did all sorts of stuff like that, but we're now on the other side.
And now it's back.
In a week. So we're not it's literally not news anymore to talk about. Right. But that's what happened in between the two shows.
Right. Yeah, the pace of things is crazy now.
You know what I mean?
Yeah.
It's just such an interesting thing about.
Yeah, when we started this, I was worried, are we going to have enough to talk about? And then now it's like, gosh, we can't even cover everything.
Yeah, we can't cover everything. We can't cover everything. I had a good week. Started on Sunday at HFMA's annual conference in Denver. Great turnout, just shy of 4,000 in attendance. It was great. Installed a new chair and had some great keynote speakers. A guy named Eric Cass, who used to work at OpenAI, and now he's an entrepreneur in residence and professor at UVA. He's got a consulting firm and writing a book and all that kind of stuff. But
we need people that have been out in the valley to work with industry. So that's good.
Exactly. So I thought he did a very, very good job from a keynote perspective, and his position was just all around, trying to frame up in terms that I wouldn't quite call a fourth grader could understand, but probably a seventh grader could understand,
what AI is.
Yeah. And not technically, but practically.
Yeah.
Right. Practically what it means for society. I thought he did a really good job with that. His position was very optimistic, but he did highlight, what he thought the big risks were. The thing he's most afraid of is low resource bad actors. So high resource would be nation states.
Yeah.
Right. Low resource would be
person in the garage, using an AI tool to figure out something that they wouldn't be able to do otherwise.
Person in the garage, exactly right. And that kind of punctuated his whole point, which is what AI is doing is bringing the marginal cost of intelligence down to near zero, effectively. So it's it's going the route of all technologies where the marginal cost gets basically slammed down to the ground to make it accessible to everybody. But in the past, that's been sort of, whether it's in the world of atoms or the world of bits, it's been process power. It has not yet been intelligence. It's not the same thing, right? You have to put human intelligence into process power in order to create value. This is fundamentally intelligence, right? And so what that means is, and he was pretty clear, it's already basically smarter than all of us today.
Yeah.
And, it's only going to get more. So he did a good job of laying out that he thought, the agentic era would really hit in 2027, which I think is
2027.
Yeah. Well, in terms of being real, not being something everyone's talking about or getting on conferences or doing press releases about, right? You know what I mean? Because we're not really there yet. As you talk about every week, when you talk about you can't get the thing to work in Slack.
Right.
You know what I mean? So right now we're just talking about it and reading headlines about it. It's not real in our day-to-day lives.
Yeah.
I think it's a fair bet to say a year and a half from now, we'll be in an era where it's not conference fodder and it's not headlines and it's not for shorts on, Instagram.
Yeah.
But it's practically.
I'll take the under on that. I think it's in mid 2026, but it could be wrong.
Look,
it's hard to know. I mean, it's all changing quickly.
Yeah, it's hard to know. I guess from my perspective, I haven't seen it yet. So to me, we're effectively a square zero with a bunch of demos that people do on stage, but nothing practical that I would really replace anything with. Right. So anyway, I thought he did a good job. He also was very educated on the healthcare space. Sort of came from a family of doctors, and so very knowledgeable about that. Covered the clinical labor shortage of the future, kind of like we talk with TK about all the time. So had that perspective really nailed, and was he was not dismissive of the job loss, identity crisis.
Which is
problem.
Common. Yeah,
he wasn't dismissive of it, but I think he's basically betting on human adaptability, to kind of get us to the other side of that, which I think to some degree makes sense. But I also think when you look at the result of the New York City Democratic mayoral primary, and Mamdani beating Cuomo, and I think largely driven by young people. I can't say how it actually broke down demographically from a voting block, but I looked at his election, party.
Yeah.
And it was all young people in there.
Yeah.
Right. And I think young people are, rightfully looking at what AI practically means for them today. And it either represents organizations that are going to hold with their existing workforce, AIify that existing workforce to get twice as much productivity, so there's still not new jobs flowing in, right? Or they're going to cut. But no matter what, that entry-level knowledge worker
if
job.
If you're 22, that's not going to help you either way.
That's right. The entry-level knowledge worker job is really pretty screwed. And I think, largely the Democratic Party is full of educated people. There's a lot of educated people in that party, especially white people. You know what I mean? A lot of like college grads, right? And so they're probably looking at this prospect and they're saying, between hypercapitalism of big tech and AI, socialism's starting to look pretty good right about now.
I mean, I think populism on the left turns into socialism often. It doesn't have to, but that's the end state of it.
Yeah.
So, I mean, there's going to be a populist movement from the left.
Has to be.
To counter the Republican populist movement.
Has to be. Yeah. I mean, the centrist movement has no teeth. Has no teeth against it.
Right. Yeah, exactly.
Yeah. So anyway, I just thought there was a lot of things this week that rhymed, and it feels like it's all starting to come out of our podcast and more into real life, but it just depends on the lens through which you see it. Like I'm not sure how many people look at the Mamdani win and think AI is playing a role in that, but I think it is.
I think it is. Yeah.
I think it is. I'm not saying it's the chief factor in it, but I think when you look at the impact it's going to have on the workforce and who it is likely to impact the worst.
Yeah, the trends were in place already. I mean, the high inflation, low upward mobility has been going on for 15 years since the great financial crisis. But it's an accelerant. AI is sort of accelerating these trends in a way that just makes it much easier for people to see.
Yeah, agree. All right. We got a long show to cover.
Yeah.
Let's dig in. All right. So to the point of all the stuff in the Middle East, once that got resolved and we got back to, ceasefire, peace in the Middle East, stock market kind of ripped.
Yeah. Everyone is excited on Wall Street. And I think that there's a lot of optimism. It is maybe not going to flow down to what we call the bottom slant of the K, but if you have more than half of your net worth in financial assets, your home, stocks, bonds, other assets, you're doing pretty well this week or in general. Yeah.
So near records for the stock market. Oil prices did not sort of get to the dreaded place everyone was really, really worried about, given Iran's position. So good news for the markets, and probably more importantly, good that there's a ceasefire, and we
definitely.
and the the people of Israel and Iran get a break from the terror.
The Trump administration is pushing for a similar ceasefire in Gaza.
Yeah.
It's not done yet, but we need ceasefires all over the place.
There's too much war going on in the world right now. Yeah, it's people throwing out World War III, and for good reason.
Yeah,
you know what I mean, for good reason. Powell reaffirms the wait and see posture on rate cuts. He called out the Trump tariffs in his latest positioning on this, and went in front of Congress and sort of defended his position. Was a little bit under attack. I felt like from the sitting Congress people, but he's the Fed chair. You know what I mean? It's like he's got to show up. He's got to explain himself, but he doesn't have to change his mind.
Yeah, I mean, I think that the last story we talked about how the financial markets are doing pretty well, but if the Fed doesn't know where the job growth is headed, and I think not headed, then who does? I mean, they're supposed to figure that out. Yeah. And so for him saying he's going to take a wait and see approach and going to wait until there's a bunch of layoffs and then do something, or wait until there's signs of inflation or not inflation, I think we need the Fed to try to get some better forward-looking data, but he doesn't have it right now. No, he doesn't have it right now. I mean, it's starting to feel like he is communicating that Trump is so unpredictable that he can't effectively model forward-looking. This is my interpretation. I haven't read anyone else say that. Yeah,
that's my read on the dynamic in the story.
Yeah, he and Trump are not friends.
No, they're not.
But independent of whether he likes the president or not, he still has a job to do. And
well, he would argue he's doing his job, right? I mean,
Okay.
I'm just.
Yeah, I think his job is to predict where prices and jobs are going, and not just sit here and wait until something falls apart. But maybe we have a different interpretation of.
Yeah, I mean, look, I guess the only thing I would say is I told our investors in our second fund that I'm going to wait until HHS gets clear on what they're doing before I make our first investment, right?
Yeah.
So I don't know. I guess I'm trying to.
You're running a venture fund, though.
I know.
If you're patient, that's your job. If there are layoffs this fall,
yeah, I know.
The Fed policy takes 12 to 18 months to take effect. So it's not going to help those people.
I know. You're absolutely right. Absolutely right. Moving on, U.S. regulators move to ease financial crisis era bank capital rules. So this is coming out of Treasury. Scott Bessent is, trying to make the, T-bills more attractive.
Yeah, we need to sell a lot of Treasury bills and bonds. Yeah. And the banks have said since the Great Financial Crisis that they maybe shouldn't be required to keep reserves against U.S. Treasury bonds the same way they would a stock portfolio or a residential loan portfolio, corporate loan portfolio.
Right.
And I think that makes sense to me. And it would have the effect then of encouraging banks to buy a lot more bonds.
Yep.
And so this will happen in the next week or so. I think they've been talking about it for 6 months.
Yep. All right, moving into VC world, Abridge. We talk about them usually on the AI rundown, but this is a financing for them. They are now valued at $5.3 billion. The company raised $300 million in a round led by A16Z. Their CEO, Dr. Shiv Rao, came out of UPMC. So he ran innovation over there. And when we were looking at his timeline, it overlapped. He basically launched Abridge out of that time that he was there. And so, the business is, I don't know, what is it, 8 years old at this point? Something like that?
Yeah, I would have said 6. I mean, it was 6 to 8, somewhere in there.
No, 6. He launched it in 2019. Yeah. So 6 years in.
He launched it before GenAI.
Yep.
And so then he was perfectly positioned to be the first ambient listening, effective tool.
That's right. So good for him. Good for him. And I hope UPMC's got a share of this because it's illiquid, but I'm sure their balance sheet would appreciate it given some of the other challenges they've been facing over the last 12, 18 months. Any other notes about this one? I mean, Abridge is clearly,
they're
one of the
market
big
leader.
Yeah, they're a market leader now at this point. $5.3 billion is a great valuation. So congrats to them. Voice AI company SuperDial picks up $15 million Series A to automate insurance calls. This is out of Fierce Healthcare.
Yeah. So this is one of many agents that are sort of populating out into healthcare services and insurance in this case. Really, this is not in the clinical side or in the sort of insurance, figuring out Medicare claims side. It's in the servicing, calling members and maybe changing an address or doing support things. And I think it's really effective at that. I don't know this company, but we have 2 investments in that space. AI is really good at sort of this logistics sort of stuff. It doesn't get frustrated with customers when they ask, where's the any key?
Yep.
That kind of stuff.
All right, moving on. Mandolin AI is, tell me about this one.
Yeah, so this is another agent company.
Okay.
But it is in the clinic. So it is.
Did they raise a round?
Yeah. Well, Greylock funded them.
Okay, so this is Greylock's like
and it's an
internal.
Yes.
Okay.
Yes, and they didn't release it anywhere else.
Okay, and they didn't disclose how much they raised.
No.
Okay. All right.
But Greylock typically does a decent size round.
Yeah. That's a big VC.
So they are helping clinicians kind of navigate the pre-approval place, or and reimbursement, kind of the prior auth is what I'm trying to say. They're navigating that piece. So it's getting into the delivery of care with agents now.
Okay. Juniper Genomics raises $4.6 million for Whole-Genome embryo screening platform.
Yeah, so this is an in vitro fertilization company that now is sort of branching into also, while you're doing that, also screening your genome, which is, I think, can be really valuable to prevent, birth defects and really bad things. It also is the on-ramp to maybe things that are, there's a lot of questions about the morality, like should you screen for intelligence? Should you screen for athletic prowess? Should you screen for whatever? Not just prevent disease, but enhance things. And so they're sort of moving in that direction. They're not doing the longevity enhancement right now, but I think that's why to cover it.
Okay. ForSight Robotics raises $125 million for a trial cataract eye surgery platform.
Yeah. So this is robotic surgery, sort of like the robots that we use in healthcare right now, but for cataract surgery. And there is not enough ophthalmologists in the market to do the cataract surgeries that we need. So I think it's a great thing. I don't mean it's early, so they are getting started. They haven't done any human trials yet, but could be great if it works out.
Okay. They raised a Series B. It's led by Eclipse, so it's a big firm.
Yeah.
All right. Precision medicine firm Caris breaks bio IPO drought. Although, I mean, I take a little bit of issue with that because they're really an AI machine learning company, not a proper
selling
biotech.
To bio. Yeah,
they're selling into bio. But they raised $494 million for a cancer analysis tool, and they have a market cap north of $7 billion. So that's a pretty great IPO for the biotech world, even though it's not an asset based biotech company. It's a tech based.
Yeah, I mean, it's not directly in life sciences, more adjacent, but I'll take the win. I mean, it's sort of, they got out public, the stock price closed up almost 30% on day one.
Yeah, it's great.
So it's good.
Yeah. So I mean, look, IPO news is great. Congratulations to Caris for a successful IPO that ended up, and like I said, $7 billion. That's a decent size IPO lately. So that's great. All right, moving into policy from NPR, which they're on the chopping block too for funding with the House right now.
Yeah.
But Medicaid changes don't meet Senate rules in big, beautiful bills as parliamentarian. I mean, the drama in this story, it is June 26th, Vic.
Yeah.
And like, when we talked about whether or not they were going to get this done on time, before it was about alignment, but, we're throwing in some twists and turns to the story here. Like, all of the Medicaid stuff everyone's been freaking out about, this parliamentarian says it effectively doesn't count as a proper budget adjustment in a reconciliation process. Is that correct?
Yeah, let me try to say this correctly.
What's the correct terminology
that's basically
here?
Right.
Okay.
In order to not be subject to a filibuster,
okay,
which is a archaic Senate only thing.
Yeah, but it happens.
Senator Byrd, who's not alive anymore, created this reconciliation process to avoid the filibuster and be able to pass legislation with 51 votes, or 50 plus the vice president. And they need to do that because the Republicans don't have 60 votes.
Right.
And so that's why it's called this big, beautiful bill. They can only do one bill, and that's probably the only thing the Senate will pass all year.
Right.
Of consequence. And so they put a bunch of stuff in it, and there's a title called a parliamentarian of the Senate who's not in either political party and works for the Senate itself. And I think it's a woman. She has declared that the reduction in the cap of the Medicaid supplemental tax process in the states going from 6% to 3%, which would save a bunch of money for the federal budget. Even though it would save money for the federal budget, it is not a budgetary item. I'm not sure how she made that determination, but she did. And so it can't be included in the big, beautiful bill because it's not a budgetary item. So they cannot keep it in if they want to use the reconciliation process, which they have to do, which means they got to take it out, and then it's going to increase the debt and cost a lot more money, and it doesn't have the offset. And so a bunch of people on the Republican side won't vote for it if it raises the debt too much. So it's in chaos right now. I think as we are recording this, Trump has a whole maybe 20 Republican leaders in the Oval Office trying to strong arm them into doing something, but it's not clear what they're going to do. And then they have to go to the House. I mean,
we still haven't even gotten back to the House yet. Yeah. I mean, not much more to talk about, but
you would think that they would have asked the parliamentarian ahead of time, but maybe she doesn't opine until the end. I don't know.
Maybe, who knows? But gosh, high drama.
Yeah,
high drama for sure. A win for HHS and RFK Jr. This is a press release on the HHS website. HHS Secretary Kennedy, CMS Administrator Oz secure industry pledge to fix broken prior authorization system. So basically this week, they got, and AHIP had a big conference this week. So potentially this was something that was announced for AHIP. But they had a roundtable. It was AHIP, Aetna, Blue Cross Blue Shield Association, CareFirst, Centene, Cigna, Elevance, GuideWell, Highmark, Humana, Kaiser, and United Healthcare, all basically pledged to improve prior auth.
Yeah.
So, I mean, I think the interesting thing is this is the kind of administration that I feel like they will hold people to things like this.
Right.
They're not.
Hopefully,
they're not really like a press releasey kind of administration. Right. They're pretty like nail you to the wall on stuff administration. So, I actually think this is news.
It'll be great if we can have just fair and clear kind of rules of the road. Like these things are approved, these are not approved unless you do A, B, C, and D. I think physicians can manage with that. Yeah. It's the unknown, the uncertainty, and the rules different every time. It's hard.
Yeah. So look, I mean, I think it's a good thing. It's a good thing. Yeah. And look, credit to at least Dr. Oz. I'm not sure if RFK Jr. was actually at AHIP, but it sounds like he was. Dr. Oz also came out to the HFMA not-for-profit conference, investor conference. Yeah. So like the guy's making the rounds. Yeah. He's not just sitting in DC. He's getting out to these big industry events, and he's meeting with the industry, and he's kind of making the points that need to be made. So
yeah, I mean, I don't know that I
impressive.
Agree with everything that the Trump administration's cabinet does, But one thing that we've talked about before that I think is true is they all have pretty good ability to speak with credibility to whatever industry they're covering. You may not like what they're saying, but they know the different sides of the issue, and then they take a strong opinion, and they're not having to like wait for President Trump to do something. They're out doing it, which I think is a good template for both sides, Democrats and Republicans.
I mean, it's at least true in the industries that we track.
Yeah.
You know, when I think about Bessent, Dr. Oz, David Sachs, again, may not like their positions on
but
things.
they know
the
big players.
It's not intellectually honest to say that they're not well-informed people, right? So, all right, moving to the next story. RFK Jr.'s public health plan, get every American to buy a wearable device. So this story came out on Tuesday, and it kind of blew my mind because right before I'd scrolled up on my phone and seen that this story came out, I just watched Dr. Vin Gupta at HFMA do a keynote where basically his whole premise was that we need to incorporate wearables into proper healthcare, because the way that we currently ask people to participate in diagnostics, they're not doing it. They're not doing it, and we're so hung up on 99%, accuracy that we're not.
Yeah,
that
perfection.
We need it. Yeah, but we don't. But what we don't care about is adherence.
Yeah.
And so it's like, okay, like let's say that the Apple Watch is 15% less accurate than the Omron, blood pressure cuff, right? So it's 15%, but it gets 10x more.
Right, I was going to say
more data collected.
1,000 more adoption. Yeah.
Right, you know what I mean? You got to at some point, you got to kind of make a call. What do you want? Do you want participation and then you come up with a protocol to sort of deal with the false positives? Or do you want to just be all proud of yourself because this device is so accurate, even though nobody's freaking using it? The current protocols around diagnostics are not moving the needle on heart disease. That's the point. All right.
That's right. And I mean, I think that it's not complicated to tier these things. Right? Like you should have a wearable, and then once you get a nervous making reading, then you give them the full cuff that has 99%. It's not that hard.
It's not that hard. It's not that hard.
So Robert Kennedy Jr. is saying that he would like to, I don't know that he has a way to fund it, but he'd like to have every American buy a wearable device in the next 4 years so that we can collect health and wellness biometrics on everyone and try to, pursue his Make America Healthy Again thing.
We probably have a decent penetration. And when I say decent, I'm talking 20%. I mean, I see so many people wearing Apple Watches. Yeah. And that doesn't, you're not wearing an Apple Watch. What are you wearing?
I'm wearing Garmin. Yeah.
We wear Garmin, right? Yeah. So Apple Watch or Garmin or Fitbit or, so many people I see are already wearing these things. Like, I don't know what percentage it is of total Americans, but man, it's already pretty high. It's already pretty high. Like it's high enough that if you just turned on whatever pilot you wanted to do with the group that's already wearing them all the time, you'd make the point.
Oh, there's no question about that.
You know what I mean? I don't think you need to get to 100% usage.
I think above some income level or net worth level, it's probably 50%.
Yeah.
There's a lot of people that are not at that income level that are not wearing it.
Sure.
But you could definitely test it and prove that it has an effect and saves lives, and then start going down the socioeconomic.
And also that income level has nothing to do with chronic disease rates. Like,
there's plenty of sick people. Right, exactly.
There's plenty of heart disease and diabetes,
that's right.
among the the middle class and the upper class. So anyway, look, I mean, I think the byline here is will this lead to the government collecting your health data? And look, that's the Trump administration has kind of earned that between the Doge data collection and all the Palantir stuff. They've kind of earned that as so I actually don't take issue with it because I think it's fair. It's earned. The concern is earned based on the, all the Doge behavior. And now it's just something they're now going to have to overcome, like actions have consequences. You take off everyone's data and you start talking about creating a unified database with this privately held company. It's like, okay, that's
fine. And true. And there's a bunch of other people that have my data already now.
Yes.
And so the U.S. government is not any worse than North Korea.
That's not the point. That's not the point, right? I'm just saying the critique
they are going to have to defend that and fight it off.
Correct.
And
and
for me,
deserved.
I'm not concerned about it.
I'm
some
not,
people are.
I'm not terribly concerned about it for myself, but I think the critique is deserved based on, the pattern of behavior. Yeah. All right. Healthcare dive. Oz hints at impending CMS rule to force drug price transparency.
Yeah. So this is going to be really another big swing if they can pull it off, which is to get the net price published, like through the PBMs, not the like list price that no one pays, but what is the actual net price through the PBMs that your employer or you are paying. And they want that disclosed. Oz dropped it at a drug transparent pricing conference. So pretty friendly audience. Whether he can get it actually pushed through, I don't know. But it'll be great that they're trying to do this. I think transparency in pricing is always positive in the long run. It would have consequences. You'd see how expensive and what the difference is.
One thing I'm struggling with a little bit here is, are we just seeing more of Dr. Oz at these events because it's Dr. Oz and the brand ID is higher than previous CMS administrators have been? Or is he simply touring these events more than previous CMS administrators have been? And I don't expect us to answer that right now, but that's actually something I'd like to know. It makes sense that he would be. This is more his bag.
He's more comfortable with the media.
He's very comfortable doing it.
Right.
But I think the implications of this and the impact of it are going to be pretty interesting. If, in fact, this is a different tact for CMS administrators, because he's a public speaker and a television person, so he's used to being on planes, hopping around and doing appearances, that this is no big difference to him. It's likely to make him a much more influential CMS administrator.
Yeah. Well,
doing the roadshow, you know what I mean? Going to all these different events.
And I do not believe that Dr. Oz does anything by mistake.
No, of course not.
He dropped this at this conference very intentionally to make news. We're talking about it now. And so it's not only that he is comfortable traveling around and making these public appearances, he also is really good at sort of getting into the news cycle and getting his point made in a way that draws attention. And I think that's true about Robert Kennedy Jr. It's true about Trump. It's true about all those guys. I mean, they are media savvy people.
Do you remember when he was at Health Further?
Yeah.
2017?
Yeah.
I mean, he was the only person we ever had that looked like he was ready to go on TV.
Right. Exactly.
You know what I mean? Like, he was ready to go on TV.
Yeah. Yeah. I mean, he's always ready to go on TV, I think.
Yeah. All right. AHIP 2025, executive insights from Aetna, Interior, and, well, they're just going with all the A's here.
Yeah. I mean, that other thing is Blue Cross Blue Shield of California. They rebranded it.
Okay.
So this was a good kind of summary. So they have 5, I think, points. We can just scroll down. And they touch on the prior auth.
Yep.
Aetna was the one that talked about it, but as we just covered, everyone's doing it.
Yep.
Yeah. They are paying attention to the food as medicine. They're moving to nutrition, which I think makes sense from the payer side.
Yeah.
They don't want to just fund groceries, but they want to make sure you have nutrition.
Right.
Cybersecurity is probably going to be a topic forever now.
Yep.
And then Blue Cross Blue Shield of California, who picked the worst new name ever, in my opinion. Ascendian.
Yeah.
Paul Markovic is the CEO, and he said that the industry has a cliff out there and is not sustainable. And so, okay, but he's in the middle of the industry. Like I don't see what the point is with that. Like the business of healthcare is not sustainable. If any industry is not sustainable, okay, then make a change. I mean, then he goes on to say that's why they got rid of CVS Caremark as their PBM. Okay, I mean, but that's a drop in the bucket for what the whole industry needs to focus on. I would have liked to see him come out with something more optimistic and positive than just, talking about how bad things are.
Yeah, I mean, I think it's challenging for the industry leaders because they have to acknowledge just what a challenging moment the industry is in right now, and there are no great solutions for it because the industry has held itself in place with poor outcomes, continuing to grow the overall size of the market largely through lobbying. Through lobbying. They've never sort of had the hammer dropped on them like it's being proposed to be dropped right now, and so they don't have a real good adaptability muscle. It's atrophied quite a bit, and so I feel like that's something that people in the industry know. They and then they also know that the work that they have to do will continue to have to be done. Like, especially
someone's got to take care of these people.
Somebody's got to take care of these people. These especially the nonprofits, right? Especially the community anchor institutions. It's like, okay, you can screw with all the numbers all you want, but like these people still have to be cared for. They're still going to have to do it.
Yeah.
And it's just going to be less profitable, and it's going to result in chaos, right? I mean, that's sort of where it's headed. So it's like, okay, cut the numbers if you want, cut the rates if you want, but like, it's going to cut jobs. It's going to cut access to care. It's it's going to make the community less stable. So I think it's hard for them, right? This is probably because I just came from a very big conference, which we'll talk about next. But I agree. We need to be optimistic, but if the leaders are more conventional, old school operators,
they can't really do it.
They can't do it, right? Mm-hmm. All right, and then this other point is about AI, make prior obsolete. Okay, all right, those are the big points. Got it. So HFMA also had their annual event. I would say, from the perspective of the quick disclaimer, I'm on the board. I'm an officer, secretary treasurer of the national board right now. I thought it was a great event. Well attended, lots of engagement. People were eager to learn. A lot of focus on AI. A lot of focus on the big beautiful bill and what will or will not be in there. Everyone's sort of admitting they don't really know how it's going to land, but most people are pricing in the loss of about 10 million, people from the Medicaid program over the coming years, and sort of figuring out what to do around that. The big reveal from HFMA was a new strategic initiative called Vitalic Health, and a U.S. healthcare vitals tracker being the first sort of deliverable out of that initiative, which is really cool. A variety of different people, not just all sort of providers, which is HFMA's sort of bread and butter, but people from across the industry, analysts on the payer side, on the tech side, credit ratings folks, all came together to contribute insights into putting together a new tracker and a new index for like how we're doing from an affordability perspective.
How the whole industry is doing.
How the country it's how affordable is healthcare in America, and it's like it's cool because I'll just scroll down here. They've got sort of two different cohorts of data that they're pulling in. One is national health affordability, and then one is longevity. And so, the categories are purchaser satisfaction, economics, affordability on the national health affordability side, and then on the longevity side is public health, environmental, and social and well-being. So it's all these are public data points. Data sets that they pull in, and then they've come up with an algorithm, weighting them,
sort of score it and compare it.
Yeah, and basically that I don't think they have it. I don't think they have the visual here, but basically we're at the lowest point that we've been in 30 years. Based on all of these factors, right? So it's not CMS, and it's not the payer's fault. It's not the provider's fault. It's like there's all these things happening at the macro level, and they collectively contribute to us being at the lowest point of affordability that we've been in 30 years when you weigh it all together. So it's pretty cool to have this, nonpartisan, fully publicly data-based index out there that kind of says, it's not the social determinants of health, but it's directionally like that, right? It's saying what are all the factors that come in
It's more quantified than social determinants of health.
Yeah, it is. It's definitely more quantified than that. And it's cool. So I'm really proud that HFMA, is taking the lead and putting this out there.
Yeah.
So
it's
that was
really,
announced.
it's valuable. It's also kind of sobering and sad.
Yeah, for sure. So it's not finalized yet. It's going out for public comment and stuff like that. But no, I mean, the goal is to try to make this like a real point of data that everyone can sort of like look at, work on, and think about. I mean, it makes me think about the work I do with Nashville Health. Which is much more.
That's what I was going to ask. Do you think there'll be regional or state-based versions of this so you can compare and maybe learn from other states?
I think you can. I think you could take the same model and then drill down at a region or a state or probably even the zip code level. To some degree, you may not have every single data point, but you probably have most. Yeah,
because it might be cool to see like, okay, Atlanta is really good in environmental,
right?
And Nashville's better at affordability. Let's try to steal from them in this, or not steal, but co-op.
Of course. I mean,
and they can take from us.
Yeah, great artists steal. Of course.
Right,
You should. So anyway, that was really cool. I had a great time. I was on a panel opening day with.
Yeah, scroll down. You're on here, I think.
Yeah. So it was me, Robin Damschroeder, who's the CFO from Henry Ford, Chelsea Glenn, who is the Chief Growth Officer from Northwell Health. They've got a really interesting model. Their health system up in the Northeast, and they're very, very focused on direct contracting with employers. So their position was pretty cool. And then Dan Lilliquist is the Chief Strategy Officer at Intermountain. And he's also one of the co-founders of Civica RX, which is that consortium, that health system nonprofit consortium of generic drugs. So it was cool. It was cool, being able to be on that panel and meet Chelsea and Dan, who I didn't know prior to this. Robin, I know she's on the board with me, but it was awesome, conference, awesome conversation, and I had a good time.
Yeah, good.
All right. Moving on to the payer side. So we've covered this story several times, but now it's now officially confirmed as of last week, I think, right? Vanderbilt University's Medical Center has announced up to 650 layoffs. This is less than 2% of their total headcount. So quantifying it that way, I think, helps. But this is the first real staff-based adjustment to try to reconcile the decrease in funding coming from the Trump administration.
Yeah, that's right. And I think they're doing the best they can. They lost a lot of support from NIH, and so they had to cut 650 people, which, as you said, is not a big percentage, but it's still 600 people in the Nashville area that used to have a good job that now they don't anymore.
Yep, that's right. The AHA is launching a 7-figure ad campaign against Medicaid cuts.
Yeah, this is I don't know. I think it's a waste of money, but maybe they have to do it just for show. They're running TV ads. We have one here so people can watch it if they want. And it's a nice feel good story about how important health systems are in our rural community. And I agree with that, but I don't think it's going to, at the end, they say, call your congressman. I just don't think it's going to it's not going to translate to like changing the legislation. I don't think.
Yeah, I mean, look, this is literally the AHA's job, right?
Yeah.
The
job is to get it changed or lobby to get it changed, I guess.
Yeah, but I think their lobbying has probably never been less effective than it has been during this particular, Trump administration plus, Republican-led House and Senate, right? I mean, it's just. They don't
have the same kind of sway.
I mean, most people don't. Like, if you're not a loyalist, you kind of don't. So no. I think that this is literally their job, and so it's what I would expect, especially given the real impact. I mean, I won't name names, but a CEO of a health system, sort of framed it to me as it's like taking $1 trillion out of the system, right? What this cut is doing. And I've not run the numbers, but I trust that person has run the numbers more than I trust myself. You know what I mean? And so obviously, if you're the AHA, looking at the specter of taking out anything close to $500 million to $1 trillion out of the healthcare system.
I mean, it's 25% of the system. That's
25% of it.
And it's the poor people and less well-off communities that are going to take the brunt of it.
Yeah, so the AHA and America's Essential Hospitals, those are the two orgs. Those are the two orgs that really should be like, spending money on ads right now. You can't do it after this bill is passed, right? I mean, there's no point in doing it then.
Yeah.
So this is it.
Yeah, I agree with that. I'm just cynical about the number of people that will call and then
which is
the
fair.
Effect they'll have.
Which is fair because people are just overburdened with too much stuff. There's a million things to worry about. So I agree. It's a hard market. It's hard to cut through the noise, an ad. So I agree with you on that. But I think in terms of them doing it, to me, it's literally their job. It's like, what I mean? All right, moving on. Walgreens sales rise on improvements in U.S. healthcare segment cost-cutting efforts. CEO Tim Wentworth said the results showed continuing weakness in its U.S. front-end sales, however.
Yeah, so they had a lower than expected loss. They're about to go private. This might be the last earnings call before they go private. And so I believe management was cutting costs and really working to beat expectations on the way to getting their go private deal done.
Yeah.
And, the business is decaying a little bit. They have weak sales, but they cut costs and they had a lower loss than expected.
Yep. I mean, I'm glad.
Good operations.
I'm glad we have something positive to say about Walgreens over the course of our last year. It's been rough. It's been really rough. All right, New York Times. We are moving into, is this Health and Us?
No, this is the pharmaceutical.
This is pharma? We're in pharma now. Okay.
Yeah.
New data shows just how powerful the next weight loss drugs may be. Oh, this is the pill.
Pill. Yeah, so we're moving to a GLP-1 in a pill form.
Yeah.
And New York Times has this article. It's coming out and at pretty much the same effectiveness. My belief is it's going to get much broader adoption. The pill is just a much easier thing for people to adhere to and want to do. So I think it's going to be even more of a influence on our health system.
When we first talked about this,
I've been waiting for that. I'm not going to do a shot.
Yeah, no. I mean, I remember, it feels like a year and a half ago we were talking about this and you were like, I'm not doing the shot, but I'll do the pill. Yeah. So here we are. Time for your pill, Vic. All right. Hims and Hers stock drops more than 30% after Novo Nordisk breakup. So that was quick. I mean, what was it 2 months they've been together?
Yeah. Not even because
it's definitely this year.
Oh yeah, because the Super Bowl ad, they were not
together
at Super Bowl.
Yeah,
that's end of January.
Right.
So sometime maybe early March they signed up together, a couple months.
Yeah.
And Novo is cutting them off, not getting their supply of Wegovy anymore. I think because they didn't like how they were sort of positioning Wegovy, but then sometimes compounding and providing a less expensive option. And there's no exclusivity, but they didn't like the deceptive marketing practices, is what Novo said. So I don't know, but my guess is Novo is more reliable than Hims and Hers. And I sort of side with them.
I agree. I fully agree. And on that note, Novo Nordisk inks a partnership with Weight Watchers to broaden Wegovy access.
Yeah. So they
trade them out.
Yeah. So they I think probably called Weight Watchers and said, "Hey, we can we move some supply over to you?" Which Weight Watchers needs. I mean, they're struggling.
Yeah.
So.
Weight Watchers definitely needs something. So this is probably good for them. All right. People with severe diabetes are cured in small trial of new drug. New York Times. Most in a small group of patients receiving a stem cell-based infusion no longer needed insulin, but the drug may not suit those with more manageable type 1 diabetes. So this is focused on type 1 diabetes, not type 2.
Type 1, and it's a very small trial, 12 participants.
Yes, but 10 of 12 were cured. Cured, because it's type 1, right?
Yeah.
So it's type 1 is incurable until I guess now.
Yeah. Yeah, so stem cell and cell therapies is going to be incredible.
Yeah,
I mean, we're starting to see now we had that
Saving Babies Lives.
Saving Baby a month ago or so, and now we're curing or maybe potentially curing type 1 diabetes.
Yeah.
Type 1 diabetes is rough.
Yeah.
So
last year we cured sickle cell.
Yeah.
In that boy.
Yeah. So it's pretty exciting.
Eyeglasses with built-in hearing aids. This just makes sense. Nuance Audio is a new option for people who resist traditional aids from the company that makes Ray-Bans and operates Lens Crafters. So just to call balls and strikes, what was it, a year ago with the new version of the AirPods. The AirPods are also hearing aids, right? So AirPods are now medical devices. They are hearing aids as well, but they look kind of weird, right? You know what I mean? Even though we're all used to them at this point, they're not like socially acceptable to just keep in your ear all the time. People will think you're being rude because you're listening to music or you're on a phone call if you have them in all the time.
Yeah, one of the stories that I cut that we didn't discuss is a story about that and the tension between in doctors' offices. Doctors don't like it. Patients sometimes need it because they can't hear that well. AirPods, literally. Yeah. And it's not socially acceptable in the same way that glasses are.
Yes, exactly. So I tried on the Meta Ray-Bans.
Yeah, I haven't tested that yet.
In December. It was December when I tried them on. I've got a good friend who works at Meta.
Okay.
And so I tried them on then. And it was a bit of a revelation listening to music through them. I would say that the quality is about 70% of what an AirPod is, right? So is it a go-to device for me for listening to music over AirPods? No. But for a phone call or for a podcast, I think it's totally acceptable.
Well, like with this is like at dinner, people that have slight hearing loss, when they go to a restaurant with background noise, they cannot hear.
Yes.
And it's really, it makes you lonely and depressed and you can't
tell what's going on.
Interact with the people.
Yeah. So for me, having had that experience and actually knowing what it's like, I absolutely get this. This makes total. If you could just combine the fact that AirPods are now actual medical device hearing aids, and then already out in the world right now, the Meta Ray-Bans, they're in general availability. They have this capability that's already about 70% of the AirPods. And
this is the same it's the Ray-Ban.
It's the Ray-Ban.
Same glasses. They're just putting new stuff in it.
That's right.
It's not all the AR, VR things. It's a simpler, cheaper device. But a lot of people, I think, they don't need all that. No. They just want to be able to hear their daughter at dinner.
Right. So I think this is really, really smart tech right here. Yeah. Really smart tech. All right. So we are adding a new section to the show as of this episode. This is 145, right?
Yeah, 145.
Okay, so let's mark it. 145. We are adding in between the Health and Us and the AI section. We're doing a small lead-in that's going to be covering Web3, right? So we have pretty much from day one, because
we've been issuing a Web3 ourselves.
Yeah, we've been talking about crypto. I feel like all through the Biden administration, we talked about Gary.
Yes.
But what was his name? The SEC?
Gary Gensler.
Yeah, Gary Gensler. We talked about him all through the Biden administration and Elizabeth Warren and how they totally screwed things over, and they gave the crypto bros to the Republicans. Bitcoin conference turned into the RNC part 2.
I mean, in Nashville, the Republicans raised like $20 million in a day, and then they were off to the races.
That's right.
Money.
That's right. That's right. And so yes, we've been talking about it for a long time, but in the last week, and again, it's kind of a Tennessee story. The Genius Act was passed in the Senate, championed by Senator Bill Hagerty. Senator Hagerty really drove that bill through. And that act for me, and I think for you too, was the starter pistol for regulatory clarity for the crypto industry in the United States of America. It starts banks really starting to engage in crypto in a very meaningful way. And I think we should take a second. It's not in the story here. We should take a second to just talk through the Genius Act and stablecoins just to frame it up for the listeners.
Yeah, I think we touched on it last week, but we didn't have a Web3 section. So we just talked about it in like brief in the policy section.
Yeah, let's dig into it just a little bit, since this is our first time talking about this topic. And I think it's got implications for healthcare.
Oh, it definitely has.
Right. I mean, I think it's got implications for healthcare. I think that payments between parties off expensive rails, there's not an industry that doesn't, track for. dollar denominated, right?
Yeah.
And that's the brilliance of the Genius Act, is that it is not focused on these highly volatile cryptocurrencies that we're still interested in, but it doesn't. It's not focused on that. It's focused on dollar denominated cryptocurrency, right? Tokens on the blockchain.
Yeah. So this is really basic financial services plumbing. That's how I think about it.
That's right.
And so it is a new technology, but it's not the risky meme whatever thing, lose money. It is the only thing that a stablecoin company is allowed to buy is a less than 94-day treasury bill.
Yes.
That's all they can buy. And they may not pay interest or current yield to anybody. And so it's not really an investment vehicle.
That's right. There's no APY. There's no.
It's a dollar replacement.
That's right.
Just like a savings account, even worse than a savings account because you don't get
anything on it.
Anything on it.
Yeah. So SoFi will beat Circle all day if you're trying to make money.
But it sort of facilitates all of these transactions where okay, I got to settle a bill with a hospital. I got to send them $8,000 on a Saturday. And I'm going to use a credit card, and then they want to charge me more because they pay a big fee.
3%. And
I don't care about the interest on it for the 1 minute I'm going to put it into this entity.
Yeah, but I prefer not to pay $30.
But I don't want to pay $30. So I move it into Circle, move my dollars from a bank account into Circle, and then I wire over Web3 rails to the health system. It's all in dollars, and the health system is very confident they will get paid back because Circle has one-to-one securities.
Yep.
And it's U.S. Treasury securities.
Yep.
It's a great and much less expensive, unless you are MasterCard and Visa. It's good for everyone except MasterCard and Visa.
Yeah.
And maybe Swift.
Yeah.
And I think you're right. At least for me, I think you said it a minute ago, it gives regulatory clearance to the crypto rails so that we can do transactions that are dollar denominated.
Yes.
There's no other clarity that we need right now.
No.
That's it. And there'll be other things that the Web3 community is trying to push through. But right now, there's plenty of opportunity just in payments.
It's huge. Yeah, I mean, the other thing that would be good, and I think we are going to talk about it. The other thing that would be good would be just giving clarity to the tokenization of securities.
Yeah, so that's called market structure.
Yes.
That's the next bill that they're taking up this fall.
And that's going to be harder.
That's going to be harder. That's not going to be as straightforward. Yeah.
But also the whole Genius Act thing, as you said, short-dated T-bills, it's going to grow the market for those. Because as more and more of these companies come in, Circle just had a very successful IPO. I think it's just like a crazy increase in that stock price since.
Oh yeah. Yes. Yeah.
Like it's multiples, right?
Yes, I think it's maybe 3x from when it came out. It's really
I heard
strong.
something crazy. Look, can I just
you can
try to find it real quick? You keep talking.
So I'll talk about Fiserv while you're doing that. So the news that we're covering today is Fiserv struck a deal with Circle, which added to their market strength. Fiserv is a financial services business that works with almost all of the banks, a lot of banks. And so they are able to now facilitate these transactions without having to go through the credit card processing. So it's much more effective.
It opened at $31 and it's at $217. That is not 3x.
Yeah.
That is 7x.
Yes.
That's what I thought. That's what I thought. They've 7x'd the stock price
since June 4th. It's less than a month.
That's what I thought. They've 7x'd the price.
Oh, should have bought it. We should buy it now. It's going to keep going up.
Yeah, it's going to keep going up. It's going to keep going up. So hopefully that helps people understand. The stock price is 7x since the IPO less than a month ago.
Yeah.
Okay. Like this is for real, people. This is for real.
And it'll be good for everyone, really.
Yeah. So with all of that, we are starting a regular section. It probably won't have a whole lot of stories.
Yeah.
Probably one or two, just kind of like the health and us area. But we're going to start covering Web3 because remember, when we started covering AI, it was kind of nascent.
Right.
And now it's taking over our show.
Yes.
Right. Okay. So we have two stories today for Web3.
Yeah. So I just covered Fiserv. they are launching a partnership with Circle to do stablecoin for banks so that banks don't have to lose that transaction. And great. And I think it's going to be very successful.
Yep. All right. And then this is more on the market structure side of things.
Yeah. Yeah. So Republic, which is a crowdfunding sort of platform.
Yeah. They're kind of number one. It's them and WeFunder,
yeah,
right? Are the
that's
two
right.
big ones.
Yeah. They are using a token strategy to offer SpaceX to people. So SpaceX is Elon Musk's company that does
Starlink.
Starlink. They do Starlink, and they're also doing the satellites and working on going to Mars.
Yeah.
All of that is in SpaceX.
And the Falcon.
And so it's very popular. A lot of people would like to own it. It's not publicly traded. So if you're accredited, you can buy it in secondary markets. But what Republic is doing is they have bought shares in SpaceX, and they're housing it in an LLC or in a shell, and then offering tokens against it in Web3 markets. And it's very transparent. You can see how many tokens are created, and you can see that the SpaceX shares are there. But it is not fully regulated yet. They're still in a gray area. Hopefully, Congress will clarify what is allowed and what's not. But they're moving forward with it.
I love it.
Yeah,
I think this is great. I mean, to me, it's highly offensive that it has been okay to buy fart coin.
Yeah.
And that Republic couldn't do this. Like, it's like, what?
Ridiculous.
It's really ridiculous, right? I mean, so I think this is great. Kudos to Republic for sure. I want to try to do it. I bet it's going to be really hard to get these tokens. I bet they're going to sell out like almost immediately. But I'm going to try to do it just to like figure out their process, just to like see how they've set it up and what the purchasing process looks like.
Well, won't the price increase if it has a lot of demand? I mean, I think the price is going to float. So.
Well, it says they're going to mirror the performance of the private shares. So the demand might grow in the secondary markets, but not in the initial offering that they do. I'm trying to get it directly from them. Once it goes on markets, it's
going to float.
It's going to float like Coinbase or whatever. It'll float from there. And that'll be interesting.
Yeah.
Like how detached from the stated private.
See, I think it's going to be more accurate than the stated private, because the stated illiquid markets on secondary space, they only trade very infrequently.
Yeah, and they only mark the books infrequently too.
Right.
They don't mark it based on daily data. So that's super interesting.
Yeah, you're going to have
like a whole new analyst kind of
It's like a poly market. It's kind of like a poly market thing. I mean, it's not exactly the stock price, but it's very analogous to the stock price.
Yes. That's
There's probably people that will arbit too, because if you're accredited, you can play both.
Yeah.
So anyway. The reason that I want to cover this is there's a lot of interesting aspects to it.
Yeah. So. I mean, I hadn't fully played that part out. The fact that it's going on tradable exchanges.
Yeah, and then the ARBs, like a family office can do both.
The thing is, Coinbase is already enabled for all that. Like it's got all the tools for everything. So the minute the token gets on there, everything is in play against that token. So ARBs, options, all of the tools you can do are then available. That's
drives
crazy.
Efficiency. It's going to drive efficient pricing in illiquid markets. Yeah. That's what I think eventually.
And it's also going to drive much better analysis.
Yeah.
But right now, if you can't get access to it, who cares?
Yeah.
Who cares?
I haven't looked at trying to value SpaceX because I don't care about it.
That's right. I can't get access
to it. But now, sure, if I can buy it and it's a better price, people will be focused on it.
Wow. That's super interesting. Another difference between crypto markets and stocks is in crypto markets, they can be all these tokens can be fractionalized down to the nth degree, whereas you cannot generally do that in the stock market.
Yeah.
You have to buy
and
they
trade 24/7. There's nothing. They don't close on Friday night at 5.
Right. Yeah. Just like Circle doesn't close just because the bank's closed.
Right.
Okay, moving into the AI rundown. I'm so excited. We're going to be talking about crypto every week now. This is great. All right, fresh off $200 million raise, Commure rolls out AI agents to tackle front office tasks, patient outreach, and billing. Again, when we say Commure, you need to hear us saying General Catalyst.
Yeah, that's right. That's right. Yeah, so I think that we're just seeing a lot of agents, and I think they're going to be coming quickly. I mean, we had a couple new raises. Comier now is they raised maybe 3 weeks ago. I think we covered it, and now they're sort of coming out with all of their agents. They're not really in the clinic. They're more on revenue cycle, administrative things. But that's where I'm watching now. Like the administrative back office, I think, is already sort of well on the adoption curve. And then as you go into the clinic, it's less so, but people are trying it.
Yeah. Tesla's robotaxis are here. What you need to know is the Wall Street Journal. The robotaxi is important because Tesla's multiple versus basically any other publicly traded car company's multiple does not make sense, right? Especially since all these other publicly traded car companies also have EVs now.
Right.
So the EV is not the thing. The thing is the front run on data, the AI play, and the robotaxi. This is where the multiple comes from, right? Is Tesla actually going to be able to be the competitor to Waymo or
That's
not?
right.
This is where the multiple comes from.
People that think it will be are willing to pay a high multiple.
Willing to pay that.
If you
high
think
multiple.
it's a car company, you would not pay it.
That's right. You would not pay it. And so the robotaxi is the demonstration of whether or not Tesla is actually worth the multiple that the market has given them.
Yeah. And they have taken a very different approach than Waymo. They have far less accurate sensors. It's all video, basically. But they have many, many more cars out there collecting video. So they are taking this low fidelity, huge volume data attempt at being accurate in how to drive. And Google has the LiDAR and cameras. They have all kinds of other much higher accuracy
it's much more
data,
expensive.
more expensive. And they have fewer vehicles on the road because they don't have the public just driving around recording things.
Right.
And it'll be interesting to see which one works or which one works faster.
Yeah.
But they launched it. They launched it in Austin.
Austin. Yep.
There's a select. I mean, basically, you have to be a social media influencer or a friend of Elon's to ride it. You're charged $420 a ride because just Elon likes that number.
Jokes.
Yeah,
likes to make jokes.
And it's gotten good results. There's been a couple cars that made a wrong turn and things, but I think in general it's been fine.
It's going to happen.
Yeah,
that's going to happen. So okay, I mean now we will see.
Yeah,
now we will see. We'll kind of monitor this on a month-to-month, quarter-to-quarter basis and see if the robotaxi becomes a real thing that starts popping up in cities all over America.
Yeah.
Anthropic lands partial victory in AI case set to shape future rulings. The decision is among the first to find that use of books for AI model training is legal under U.S. copyright law.
Yeah, so Anthropic purchased a large number of used books and scanned them and made the claim that
they're studying.
That was their choice, and they bought the book and they were using it in a way that they're allowed to do, and the court agreed with that. They won that side. They also have pirated or not properly bought a whole bunch of books.
Yeah.
And the judge set that part aside and is saying that is not okay, and we'll have to have a new trial to discuss that. So they won when they did it the right way.
This is going to be a very low toll.
Won.
It's going to be a very low toll. Buying something in the retail market is not the royalty that these content holders want.
That's right. So the reason, even though they didn't get the pirated side kind of kicked out,
they don't need it.
They don't need it. They're gonna buy.
They don't need it.
They're just gonna buy those books.
This precedent is easy.
Yes. So they're gonna buy books on Amazon or some used book place, and the books don't cost that much. So and there's a finite number of books, and so when you are, I mean, when Meta's paying people $100 million as a signing bonus, you can buy all the books that have been published for probably less than $100 million.
Yep. This is a big win.
it's a big win, and it's, I think it makes sense to me that what the judge said is they took the books, they used them literally in a way that is fair and you're allowed to do for the fair use category. Then they have transformed it into another purpose. And that's the point of copyright law. You can't use it the same way. But what she said, I think it's a woman judge. The judge said that it's like if you didn't allow people to teach books in school and then use it to help with teaching writing, like that's not how what copyright's to protect.
Judge William Alsop. So no.
Oh, okay. So I messed it up. But, yeah.
Ars Technica, Google's new robotics AI can run without the cloud and still tie your shoes.
Yeah. So Google has been working on these humanoid robots and an operating system that will sort of allow them to run. And they now have solved the problem of if they go out of coverage because they're in a home that doesn't have good coverage or something goes down, they can keep functioning. They don't need always to be connected, which is a huge advance and going to make it much more likely to have use in the world.
We're getting very close. We're getting very, 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 very close to the movies, man.
Yeah.
Getting very close to the movies. NVIDIA ruffles tech giants with move into cloud computing. Things are getting awkward for cloud incumbents as the AI chip giant eyes their turf. I mean, I think this is not that awkward.
Yeah, or surprising.
Yeah, both Google and Amazon make AI chips.
Yeah.
And NVIDIA, it does not have the global cloud infrastructure that either of those two companies have, or Microsoft for that point. And so everybody is going to do everything, but only some will be, top tier at certain things. NVIDIA is the top tier in the AI chip. That's no question about that. They're getting in cloud. Sure. Fine. They're going to have, there's some reasons for them to do that for their own networks. And there's probably some cache of clients that will really enjoy being on the NVIDIA cloud.
Right.
They're not going to take a huge chunk out of Amazon or Google anytime soon. Because the reality is you just got to lay a ton of fiber to do that.
That's right. I mean, they're in the top 5 most valuable companies in the world.
Yeah.
They need to have sort of the ability to be independent.
Sure.
And not rely on anyone's cloud.
Of course.
And so they're building their own. They're learning how to do it. Just like Amazon and Google need to be independent of the chips. And they're building their own chips.
That's right.
And they will work with each other. These companies are very comfortable being frenemies. And so I don't think it's awkward at all. I think they're all going 100 miles an hour in the direction of making the most money they can.
Yes.
And they're all trying to learn about everyone else's business. But you're right. NVIDIA is not going to run the best cloud ever. And I don't think Amazon's going to have the best chip ever.
No. I mean, Oracle is playing catch up on the cloud game.
Yeah.
You know what I mean?
Right.
Like, it's like, yeah.
And we need more cloud. I mean, there's no shortage of demand for cloud.
We definitely need more cloud. Yes, agree. OpenAI Microsoft Rift hinges on how smart AI can get. Silicon Valley is at odds over whether AI can reach and exceed human-like intelligence, a milestone with major implications for the startup and technology giants partnership.
So scan down to the right here. So this is the fight is, one, Sam Altman and OpenAI are trying to get out of the contract that they signed. Like we talked about that last week. The way they are working on this now is that if the company achieves artificial general intelligence, then they do not, supposedly, that is to be used for the good of humanity, and they can get out of the Microsoft contract. So OpenAI is trying to claim that they have achieved it, and Microsoft is trying to claim that they haven't achieved it. The problem is there's no definition. Like it's not a defined thing. So you could argue that they have achieved it now. You could argue that they'll never achieve it. It's a vague term that is ill-defined. So they're just going to fight. But you can see here, like there's 3 things that they are fighting over. have they achieved AGI or not? Because that would get them out of the contract.
Right.
OpenAI has to convert to a for-profit to keep the money they've raised, and Microsoft won't let them unless they get more ownership. And then they're trying to figure out how they're going to partner as OpenAI starts competing. And unlike NVIDIA, I think Microsoft, partially rightly, thinks like, we helped you get to where you are, and so you cannot now buy Windsurf and compete with our code product called Copilot. And they're not wrong about that.
No, listen, Sam clearly has ambition to be the top dog in tech, right? I mean, that's what he wants. He wants to be the top dog in tech, and he retrades deals. Yeah, he retraded on Elon. He retraded on his original team and board. Yeah, and now he wants to retrade on Microsoft. I am not sympathetic to him at all. Yeah, and it's pretty cool to watch Satya Nadella like hold him accountable. I think it's cool. I think it's great. That's my whole view on it. I don't like people who retrade deals. Yeah.
Yeah, I agree. And we'll see. I mean, I think Microsoft has a much stronger legal position.
Yeah, they do.
So
look, Satya is no dope. Right, he would not be saying these things if he didn't have the ace cards. Yeah. Right? Sam has a track record of doing these things. So regardless of whether or not he's got the ace cards or not.
Yeah. I mean, I think Sam has the Silicon Valley mindset. Like I have the customers, I have the brand, right. I'll end up winning.
Right.
Like Uber. Right. Uber did that.
Right.
But like
I
taxi
will win.
drivers, they have the medallion. We're not really allowed to be doing rides in these cities, but who's going to stop us?
Right.
But I'm not sure that Microsoft is the same as like a cab company.
No,
so I think it's a different, it's kind of a different, it's a different fight.
Yeah. Agree. All right, final story. Alpha Genome, AI for better understanding the genome. This is Google's DeepMind. This is pretty cool stuff. DeepMind just continues to sort of roll out these deep bioscience, genomics APIs. Yeah. AI-based APIs where you get to access, all sorts of things on the genome and proteins and cells, and it's just amazing. And it's free for research use today.
Yeah, that's right. And I'm following this just because I think it's great for healthcare, for our society. They are putting out, it takes a long, like your entire human genome sequence, or you could take a particular cell type, and they will scan it and sort of predict what their molecular protein output is going to be. And it's really helpful in diagnosing disease and what is causing this disease and maybe different variations of a disease. And so I think it's great. It's like AlphaFold before it. It's incredibly powerful. It's hard even for me to get my head around like all the use cases, but they're vast. There's a lot of use cases.
Yeah, agree. So look, I just continue to feel like, Google was telling the truth. I think they really get a bad rap because their core business model is advertising. But I feel in so many ways they've been a much better actor than Meta when it comes to advertising. I think they've built, really, really strong complementary platforms to their search business, like YouTube. I mean, they acquired it, but they built it up. I mean, when they acquired it, it was small. It was nothing compared to what it is today. So, you look at YouTube, I think their productivity tools are, from the cloud perspective, are on par with Microsoft. I think they're better, but obviously the enterprise buys a lot of Microsoft. So, I think you just have to sort of accept that, they split the market pretty well. And then they still are offering just all these incredible, open source tools. They open source Transformers. It's the reason why we're even having this conversation. They contributed that to the world, and they can continue to do these really great research based things. And it feels true to the ethos of Larry and Sergey, who were just two nerds at Stanford, to see Google continuing to do this kind of work, Yeah. And so I like that you found this story and that you continue to sort of bring in these deep mind, science contributions. It's just really cool.
Yeah. I mean, I think Google doesn't get as much attention in the AI space, but I think they're the dark horse to win the whole thing. I mean, there's a lot of talent.
That's what I'm betting on.
A lot of talent there.
That's what I'm betting on. Okay, man. Awesome show. Thanks for lining it up. Next week, I have to find a guest host, which I have not yet done. You'll be out of town. I'll be recording on Wednesday, and then taking off for the 3rd and the rest of the 4th of July weekend. So anyway, great show. I'm psyched that we're going to start talking about Web3 on a regular basis, and we'll see what next week brings.
All right, thanks.